Hi, welcome to the Healthusiasm podcast, a panel discussion on behaviors, innovations, and trends in health and self-care. My name is Christophe Jauquet. I'm the author of the Healthusiasm books and a professional keynote speaker on health, business, and technology. Now, if you're new to the Healthusiasm podcast, you might wonder what Healthusiasm is all about. Well, Healthusiasm is the aspiration that we all have to be healthy and happy. And as a result of this, every company or organization is now more than ever focused on making their customers healthier and happier. And so every month I discuss with a panel of experts the positive changes that are shaping our health and happiness. And for this discussion, we have three of your beloved experts in the panel, actually 2 plus 1. We'll get to that. But first of all, calling in from Barcelona is our digital health connector, of course, Aline Noiset.
Hola.
From Scotland, but living near Brighton, medical expert in digital innovation, Dr. Keith Grimes.
Fit like everybody.
Hey. And well, I would say last but not least, but he couldn't make it today because of a technical issue with his computer, human experience expert Mo Zuwina, who actually tomorrow has to celebrate his birthday because he turns, I don't know how old he is actually. Do we know?
He's 21.
21, yeah. He looks super, super young and radiant. We wish you a very happy birthday, my friends. We are missing you. But in that case, when we have a panel missing, we always invite a special guest to our panel. So some new blood, some other expertise. And in this case, for this episode, we have Agathe Acchiardo. She is actually a good friend of the Healthusiasm panel, at least of every panelist here. And someone with very similar interests as myself, actually. She has a background in both pharmaceuticals and in trend watching and foresights. And that's exactly what she is doing today, because she brings trends and future studies into the healthcare world. And she works on projects that include the ideation, the development, and the testing of new products and services for patients, caregivers, or doctors. Welcome, Agathe.
Thank you, Christophe. Thank you for the invitation. I'm delighted to be with the panel today.
It's good to have you. How are you doing, guys?
All good?
Yeah. Recovering from a cold last week, which is why my voice is a little bit squeaky and boomy. My apologies to those with sensitive ears.
Well, I'm extremely tired today, so I hope I don't speak too much gibberish or don't find my words in English. I already said one mistake, so let's see how many we'll rack up here today. Anyways, good to have you back. This is episode number 20, and we have a great show coming up, of course. We will talk about impact on cities, of the impact of cities on our health. You see, I mean, I'm already talking gibberish. We'll talk about the impact of cities on our health, and we'll talk about the impact of robots on our health and self-care. But first, maybe some healthusiasms, some positive changes that will impact our health and happiness. Tell me, Aline, what healthusiasm did you witness in the past months?
So it's a news coming from Google. So Google wants to track burnout through our computer keyboard. So Google has patented recently a personal wellness keyboard that would use AI to track and respond to feelings and behaviors through the use of the keyboard. So the system tracks 3 kinds of user interaction with the keyboard: typing speed, typing intensity, and content types. So the idea is that the system will track a user over time to establish their baseline. For instance, how fast do they usually type? And then the AI would identify the deviation from that baseline and send subtle timely feedback to the user. So for instance, let's say that the system detects that the user is stressed. So it may illuminate the keyboard for mood lightening or as a reminder to relax for the user. And they even may go a step further and connect the keyboards to a wearable sensor, such as a headset or smartwatch, that would monitor other physical data like stress, sweat response, cardiac activity. So I thought that was a very interesting news for those of us who are spending a lot of time on the computer.
It definitely is a very interesting one. And it really fits one of the bigger trends, I believe, which is ambient health or ambient sensing. Because, through not actively measuring or doing something actively, we actually get some information about our health. And I saw something similar passing by from Samsung, which announced the Galaxy Smart Ring. And so it will also offer sleep insights based on heart rate, movement, respiratory indicators. It will even do some period and fertility tracking. So it means that it will go in a direct competition with the Aura Ring, which will be super interesting. Everything will be stored in the app, of course, where they will add a new score, the My Vitality score, which is based on all these different parameters. And it will give you some updates and tips, which they will call booster cards. But what is most interesting about this, because it's yet another ring, and it comes from Samsung, which is a little bit more interesting now. But the most interesting part was that the Samsung's VP of Digital Health, which is Dr. Han Pak, something expressed, I think you need to say it like that. He referred to it as one step towards a future where they're building a larger ecosystem of ambient sensing. And so where they want to go to is they want to create what they call a connected care that is centered around the home. So they really envision a holistic system that supports individual health goals rather than a single gadget that is bombarding user with contextless data, basically. So they really want to build this ambient sensing even further into our homes. I really liked that evolution, and I think it was something that really went under the radar. Medical devices. I go to you, Keith. You have some insights on medical devices, right?
Yes, absolutely. And what's interesting about my Healthusiasm is that it was an independent report published about a week ago, just over a week ago in the UK, called Equity in Medical Devices. And the clue is in the title. This is about making sure that medical devices and medical software, in this case, is free of bias and free of discrimination against minority groups. Now, where did this all come from? I think we're all aware that during the COVID pandemic, there was a big uptick in people being able to use pulse oximeters, devices that are able to estimate the amount of oxygen inside the blood. And of course, that's very important with respiratory illness. But there was the observation that was not new that these devices did not perform as well in non-white people. And in fact, there was a publication in August last year from JAMA, which actually looked at this and looked at clinical outcomes. And what that showed is that pulse oximeters tend to overestimate the amount of oxygen in the blood of people that have non-white skin. And the impact of that is that it delayed their treatment for COVID in this study as well. So real world negative impact from devices that haven't considered fully their populations. In any case, a previous health minister in the UK, Sajid Javid, commissioned or tasked this new report to be put out, and it just came out just now. And it makes a very interesting reading. It's got a nice short summary for those that want to see it. But it looked at three areas. It looked at pulse oximeters and other optical devices. It looked at artificial intelligence, and it looked at polygenic risk scores. Within that, they looked for evidence and found ample evidence of bias. The evidence of harm with the medical devices, particularly oximeters, was mostly from the US studies, but there's a strong implication that there may actually be harm as a result of what's happening right now. And as a result, they came up with a number of recommendations, 18 recommendations with multiple sub-recommendations that were all very, very sensible. But if I want to summarize it, what it was talking about was the need to immediately address what's going on to try and inform those working or using with these optical devices of the limitations and to take care, to work with manufacturers and the public so that we address with a very diverse group of stakeholders, either for the purposes of research or, making sure that they're used appropriately in the real world, educating the public, professionals, and then commissioning more research. And as ever, they also talked a great deal about the transformative effect of things like large language models. So it makes for some really, really interesting and sensible recommendations, all of which were essentially accepted by the current UK government, with a few little wriggles in there as well. But it was very, very nice to actually see some good consistency about how we can improve going forward and make sure that we minimize the impact. So I'd recommend it to everyone on this. It was very good. They also said that we need to look ahead about the use of wearables. You're talking about Samsung rings and Aura rings. Exactly the same thing. We don't want these new devices to perform differently in different people with different skin colors. Pregnancy, pregnant women and neonatal people are often excluded from research. We need to correct that. And then, of course, with all this fancy new technology, we need to make sure that it's available to as wide a group of people as possible. So in terms of the theoretical things made real with some practical applications, it was really lovely to see this article come out. And it's very readable. Do have a look.
So yeah, health equity, it is definitely a very important topic in healthcare, of course. We actually talked about health equity in episode 8, where we also talked about human enhancement. Definitely a topic also worthwhile thinking about health equity. But maybe the next Healthusiasm is also slightly related to health equity, or at least I'm not quite sure whether the example I will give you is a great example for health equity, because I'm talking about Sand Clinic. Sand Clinic just raised 4 million in funding from the two Spotify co-founders, Daniel Ek and Martin Lorentzon. And Sand Clinic is actually a clinic in Stockholm that is trying to disrupt healthcare as well. A bit like Ek, the Spotify founder, already did with his previously clinic Neko, where he invested in full body scanning. And you might remember that we talked about it as well on this podcast. But Sand Clinic is a bit of a bigger approach, a bigger primary care setting, but also focused on preventive health diagnostics. But it adds personalized programs. So there's personal trainers, there's therapists, there's dietitians who oversee the gym and the wellness therapies, but there's also doctors and physiotherapists, psychologists that all conduct exams and might even, provide gynecological care or do some vascular ultrasounds whatsoever. There's practitioners that might be doing lab tests, biomarkers, who might be analyzing wearable data, if you will. So it's a very nice concept. Again, primary care setting, preventive health, where you can work on your own health. Interestingly enough, it's also with a membership, and that's where the non-equity part maybe comes in, because the membership fees range from 1,000 euro to 10,000 euros. That is per month. So not really very equitable, if you will. But an interesting evolution. And I have to say, it's sometimes you need to start with the ones that can pay it before it becomes broader. That's part of innovation, I would say. But what is remarkable is that these types of clinics that actually cover different areas that goes beyond pure medical stuff, let's say, we've seen them more and more. And I really like this evolution. That it goes beyond just the medical, but also the movement, the exercise, and even food. And we stay with food, and we go to you, Agathe. You had one on food, right?
Yes. So for me, the bit of news that got my attention is actually from last month. It's coming from the UK-based charity Nesta, which drives innovation for social good. So end of February, Nesta released a very interesting report advocating for a new policy to set targets for healthy foods for the largest food retailers. So for context, in the UK, it is estimated that 3 out of 5 people are now overweight or obese. And at the same time, the top 11 grocery retailers, might be brands like Tesco or Asda or Waitrose, they make up 95% of the grocery market in the UK. So they are a little bit the gatekeepers. They have a huge impact on what people can buy and, of course, what people eat. So the Nestle report is advocating for mandatory healthy food targets in this big grocery retailers chain in order to incentivize the retailers to make it easy for people to choose healthy food options. According to Nesta, and that's very interesting, in their reports, they estimate that this policy could reduce the calorie intake of about 80 kilocalories per day per consumer. And when you aggregate that across the whole UK population and every day, they estimate that it could help reduce obesity by about 23% and help 4 million people achieve a healthier weight. So what I found very, very interesting in this approach is that it shifts the narrative on obesity away from the question of personal responsibility when making healthy choices. And it points to a much, much bigger picture about the food environments we live in and how these food environments shape the choices that we make. Because we all know it's much easier to make the right choices when you actually have the right options to choose from. So I found it was a very inspiring approach at systemic level on how to drive better healthy lifestyles.
Yeah, I really like that one. And as you say, it's really interesting. And I also find it interesting specifically because we're talking about achieving a healthier weight without mentioning the word Ozempic, uh, which is remarkable. I mean, most of the time when we talk about losing weight, it's in the context of Ozempic, which we haven't done. Which we also haven't done is we haven't talked about AI during the Healthusiasms. So I have one more from In Silico Medicine. Maybe you've heard it, maybe you've seen it, but for the first time, an AI designed drug is in the second phase of clinical trials. So it never happened before. It was done by In Silico Medicine. So the entire validation process, even from discovery to the approval, and in general, if you put a drug on the market, it takes about 12, 13, 14 years, and it costs about $4 billion. But you have to know that in the first phases, when you go to these processes of creating drugs, 90 up to 95% of the initially promising drugs, they don't come through. They actually are not sufficient enough. And so there's a lot of investment that is done that is then thrown into the garbage. But by using AI, they not only select better potential compounds, but they also manage to get it faster through the entire process. And so if you only look at the phase 1 clinical trials, it takes about 7 years. Now here, AI it's Silico Medicine with AI, they completed these steps in about 3 years. So that's twice as fast, let's say. And it's very interesting case because, I mean, there's more coming in the pipeline, of course, but this is the first one that goes that fast, that goes into the second phase of clinical trials. And it's very interesting to see how far and long it will go even, because we never seen this before. So as per usual ones, to close the Healthusiasm section, I have a couple of unusual ones. And I'll first go back to you, Agathe. You're new on the show, so let's start with you then. I don't know if you read, I know you read a lot of reports, but maybe, I don't know if you read the Rock Health's 9th annual consumer adoption survey report. It just came out about 2 or 3 weeks ago. And it really was an interesting report. Rock Health always has very interesting reports, but there was something very specifically interesting in there. And I know you like numbers, I know you like trends. And it mentions something very interesting on the consumer's view on sharing personal health information. What is the trend that we are seeing there? How does that trend go? Sharing personal health information. What would you expect in that report?
So first, it would depend on the countries you're looking at. Rock Health usually does US market, so I'm assuming you're expecting a US market response.
Yeah, I'm not quite sure. I think it's mostly US indeed. Sometimes I do Europe. I can't remember. I didn't write it in my notes. But let's assume it's US. It definitely is going to be US, that's for sure. So what is the trend that we've seen when it comes to sharing personal health information?
Well, what I've seen in the research I've done is that usually consumers are slightly more willing to share their data in health, provided that it's extremely clear about what will be the purpose and who they are sharing with, and the assurance that the data would not be transferred to third-party data or third-party companies without their consent, provided that this is a question that was asked, or whether the data are anonymized. There is a certain appetite for some consumers to share data, especially in the field of health, when there's a little bit of a sense of philanthropic data sharing. People realize that some of their data might be useful for other people, might be useful for research and development. And especially if you talk to people who are suffering from a rare disease, their willingness to share data will go through the roof because they know they are rare and they need to contribute data to bring the research forward. I'm not sure that was exactly the population in the Rock Health report. I'm assuming it's more of a consumer report, but that's what I would assume you might be referring to.
Yeah, I mean that would also what I would assume, and also I worked with in market research where indeed patients want to share to help other patients. But what the report showed is that actually in the period 2021 to 2023, people are less willing to share their data. And maybe, I mean, it comes with a lot of ifs, right? I mean, you only share your data if this and that, as you mentioned. But just merely looking at the willingness to share data with physicians, it went from 72% of consumers to 64. So that's minus 8%. Sharing it with research organizations had a major stunningly drop from 50%. It went actually from 35% to 18%. So that's a drop of 50%, basically. With insurance companies from 53 to 45, meaning that they will trust even insurance companies more than research organizations. And for health tech companies from 25 to 14, pharma companies from 22 to 13. So it's an overall drop for any type of potential partner you can share your health data with. It's a drop of at least 10%, which is amazing, I think.
I wonder if that might be linked to some data breaches that were quite high profile in the US. For instance, 23andMe
Yeah,
had
for
a
sure.
data breach, and their response to it was not very, I would say, consumer friendly. So that might be linked to some high profile cases like that.
Sure, but it's a remarkable thing that we need to take into account. And there's other technologies like blockchain and solid bots that come our way that maybe might be interesting to look at then with this regard. Keith, you wanted to add something quickly here?
Yeah, no, I was going to say I'd be interested to hear what the authors of the report thought were the reason for it. My first thought when we were talking about this is that it chimes with roughly the same sort of rise in skepticism about expert opinion during the pandemic. You know, there was a sort of general feeling that people didn't want to put their faith in well-proven science and technology and chase some other ideas. So I don't know whether that was mixed in. Did the report mention any other thoughts other than that? And also what Agathe was saying about breaches.
Yeah, totally true. And I think what we've seen in the Edelman Trust Barometer, which is a great indicator of how people trust certain institutions, it definitely shows that people have less trust in companies, have less trust in governments, have even less trust in the healthcare system. And this is something that we need to be wary about or conscious about. Keith, I'll stay with you for something related to AI and dementia. Remember in previous episode, I talked about synthetic memories?
Oh, yes.
Where patients could actually create images from their past based on what they fed into a image generator, an AI image generator, of course. Now, my questions to you is that there is a new solution in that same area. It's called Sensei, and they say they introduce a groundbreaking approach to AI in dementia care. So we talked about synthetic memories, but what could they do? How could you apply AI again in dementia care? Be creative.
Yeah, I suppose it's interesting. I mean, everyone's got groundbreaking changes. So let's think this is about creating synthetic memories. I wonder whether, or synthetic images from memories, I wonder whether what they're doing is finding a way of encoding some of a person's personal history and becoming a kind of outsourced memory, either through questions to the person, questions to their family, and therefore being a sort of external memory that they can call. That's my first thought here. I don't know whether the name Sensei, either that or it teaches them how to do karate, but I think it's more about like a personal AI. That's my guess.
Yeah. By the way, it's written as Sensei and it ends with an AY. So it's not the Japanese Sensei. But what you're saying was exactly right. And so where they are heading to is they want to recreate replicas of their loved ones or even their entire memories that they shared with them, so that they can actually talk to the app, share some stories, record some moments, and have conversations with people probably from the past in that regard, because those loved ones will then be replicated bit by bit. So I think it's very close to what you say. An interesting evolution. I think we're early stage there, but I found it an interesting approach that again shows what AI could do.
One of the things that I would say, just hearing that, is that, you know, I can hear the positives, but again, it's about consent. It's about capacity to understand. You know, if you have a person who's maybe got a degree of cognitive impairment, how can we be truly sure that they're giving informed consent for this to happen? Because the question is, what's this data going to be used for? What happens to this synthetic persona once the person has passed away? Does that persona pass away, or are they going to be tempted to persist this? And, I think there's some very interesting little wrinkles in that as well.
Yeah, and it's a great bridge to the one for you, Aline. Lou Reed. He's been dead for 10 years. And his wife, Laurie Anderson, she's the widow. She's the longtime collaborator of Lou Reed. She just recently won a Lifetime Achievement Award at the Grammys this year. But she was in the news for another reason. Have you heard why?
No.
It has to do with AI. It has to do with what Keith was saying. And it has to do with one of the topics that we discussed that you actually brought forward in Inside Out in one of the previous episodes. I think it was episode 18, no, 19.
The hologram, no?
Yeah.
The wedding with the hologram.
Exactly. But in this case, it's a virtual companion again of Lou Reed himself. She made it 3 years ago, and she actually made 3 of them. And she actually talks to that AI version of Lou Reed every day. She says she's addicted to him, and she still makes music together with him because that was what they were doing together. So I really like that one. It made me think of you. So because you brought that topic of the virtual companions, and I looked it up, episode 7. And I think it was a really, really, really nice one.
So the question I have here, Christophe, is if they're still making music, are they planning to release some new music from Lou Reed? I'd be interested. So that's why I want to know if there's new music coming up.
Well, I think I'm not quite sure whether they've done it. I know she's still making music, but I'm not quite sure whether she still brings out his music. But if you want, I don't know if you heard about the 27 Club. The 27 Club came out 3 or 4 years ago. And so there's a lot of rock stars like Kurt Cobain and Jimi Hendrix and some others.
Amy Winehouse.
Amy
is the other one.
Winehouse. Yeah. And then you have Janis Joplin as well. And so AI made new music from their existing musics. And so you really need to look it up on YouTube. You can't say that it is not Nirvana. You can't say it's not The Doors. Jim Morrison was also part of it. It's amazing. And that was 4 or 5 years ago. It was just something, it's just literally new music. So I can imagine that this will happen with Lou Reed and maybe others. And the very last one, and then we're taking 30 minutes for the Healthusiasms this time, but I think they're pretty interesting. I had one for Mo because it was his birthday, but I'll ask it to you. It happened in Scotland, so maybe you might know it, Keith. The Midlife Sex Festival.
Oh, Scottish Sex Festival. All right, okay. Tell me more.
Well, it's actually to address sexual health of menopausal women. So it really didn't have anything to do with more besides the word midlife. But yeah, it's a very interesting festival. Spans over a month, features over 30 experts that provide science-based sex education, mostly for women in the midlife who are going through menopause right now. And so they really discuss openly the effects of menopause, specifically on their sex life. So they talk about how to do self-care, they talk about hormone replacement therapies, the benefits of sexual pleasure aids, and so forth. So I really like this example because it was like putting it out in the open. Again, I think in Women's Health, this is something which is super interesting, and definitely in menopause, a lovely way of doing it in a fun way, like calling it a midlife sex festival. I think it's amazing.
It's a shout out to what we were discussing in previous episodes as well about a person's sexual life expectancy as well. The idea, of course, there was this very retrograde idea that a person's sex life was absolutely sort of nailed against their reproductive potential, and therefore, sex stopped for people after menopause and so on and so forth. Of course, these are crazy ideas that are being rightly challenged right now, but you're right. It's about making sure that these things are discussed in the open to be able to change it, because there's not just the biological aspects of it about changing hormone levels and the like, but also the social expectation that a person should be able to enjoy pleasure at all points in their life as well. So go Scotland for bringing it out as well. I've got a mental image of what this festival might be, of all these perimenopausal women celebrating their power in somewhere like Glasgow. It makes me smile. It's a positive thing. Very much in support of that.
Yeah, positive thing, like all the Healthusiasms, and thank you all for the Healthusiasms, because it is indeed a Healthusiasm world. We see so many positive changes, as Keith was saying, that are making our world a little healthier and happier. If you want to know more about these Healthusiasms, go to healthusiasm.com and discover the other episodes or subscribe to the newsletter. Again, if you're interested, subscribe via healthusiasm.com. Now, let's move to the next segment of the Healthusiasm podcast. Is it something, nothing, or everything? Every month, one of the panelists brings an idea, innovation, or evolution forward that sparked their Healthusiasm. The rest of the panel will then debate and share their opinion about it. Do they find it something, nothing, or everything? Aline, what sparked your Healthusiasm this month?
So I would like to discuss with you the role that cities could play to improve quality of life. So I read an article from McKinsey Health Institute, and they think that a focus on immediately influenceable interventions at the city level can add approximately 20 to 25 billion years of higher quality of life at the global level, which is approximately 5 years per person. So we know that the global longevity has arisen. So we're living longer, but we're also getting more sick as a consequence. So the disease burden has increased. And there's also external threats to global health, like climate change and antimicrobial resistance, that will add to that disease burden. And the disease burden requires to look at factors beyond healthcare, like including prevention, health promotion across all fields. And every institution and every individual has a role to play, and especially the cities, since many of the long-term drivers of health can be activated in the cities. So we have to take into account that today more than half of the global population live in cities, and that percentage is projected to increase in the next 30 years to 70%. So that's a lot. So what McKinsey are saying is that immediately influenceable interventions are an effective way to start acting in the cities. And they define mainly 3 interventions. So the first one is healthy longevity. So meaning addressing chronic diseases through screening access, screening programs, better diagnostics, diet recommendation, and better food choices, like Agathe was mentioning before. And they also including older people in societal activities. The second intervention is brain health. So increasing access to mental health support to address anxiety, depression, substance use disorders, even neurological conditions, by training clinical and non-clinical workers to arising techniques such as cognitive behavioral therapy or interpersonal therapy, so more people can have access and benefit from this mental health support. And the third one is climate-related health. So developing climate and heat action plan to protect vulnerable citizens, like people who don't have a decent place to live, for instance, or the people working in the heat. And that also includes urban greening to mitigate the impact of extreme heat by having more green areas and more sustainable public transport. So my question to you now, so cities becoming healthy cities through those immediately influenceable interventions, and cities being a great way to achieve health for all, is that something, nothing, or everything? Keith, what do you think?
I really loved this. Thank you for sharing it. It's been, and now I don't live in a city anymore. I live on the south coast of England, although I go up to the city very often. So I think this is somewhere between something and everything. I'd say it's about 70% of the way there, because of course you mentioned that it's about 70% of the population in there as well. But I mean, I genuinely think that it's a very big part of our push towards a world that we all want to live in and live long and well in. There was a couple of things that came out of the report that you sent. The first of which, I didn't realize that for every year of life that we have added in life expectancy, 50% of that is in ill health. And, you know, that's quite shocking about a deal if you came to someone and said, you know, I can make you live another 10 years, but 5 of those you're going to be really ill. I don't know whether people will be happy about that. And it's gone a long way to help me reframe the work on longevity and so on too. So the report, I think, is nice because it's very practical as well. It talks about rapid solutions. And of course, Agathe, earlier on, you talked about Nesta, and I was immediately thinking about the impact of You talked about brain health. There's also brand health as well, the role of these big providers being able to get us in the right direction. I think what's interesting, I was recently at a networking event and there was a lot of climate tech people there and they were talking. I was very surprised to hear that in countries like the UK, biodiversity is already higher in cities than it is in the countryside because of how our farming practices and so on. So I think that there's a really good opportunity for us to lean into this trend of people concentrating in one area, greening and rewilding and increasing the diversity in our cities, which make them more pleasant places and more climate resistant, which can impact on mental health and physical health. And yeah, see the benefits of it. So I'm all for it. On the flip side, what seem like very sensible ideas can often have a lot of pushback. I talk about, 15-minute cities, which again is a concept that makes a great deal of sense. Who wouldn't want to live in a city where the things that you need are very close by? Well, apparently there's quite a lot of people that don't like it because they associate it with the Illuminati locking us in our homes and so on. So, that's a little bit of a worry in there. Also, how do we make sure that we help people outside those cities? But outside that, I think this is a really, really positive way forward. And I'm all for positive changes.
And those 15-minute cities, that's also what the line wants to do. We discussed that also in previous episode, the NEOM in Saudi.
It was actually a 5-minute city, I think, that they wanted to achieve. Yeah.
It was 5 minutes?
Yeah, it was even shorter, I think. I mean,
5
they
minutes
have to.
It's too close. It's too close. 15 minutes is better.
Yeah, I agree. Christophe, what was your take on this article?
Well, obviously, to me, it's everything. I mean, one of the things that the ideas behind Healthusiasm is that every business is a health business, and because every business can have a major impact on the health of every one of us. And so there's a lot of businesses in the city, so which obviously leads to the fact that the city can have a big impact on our health. And there was one of the numbers that I really liked in the article that you shared is that if you look at supermarkets in London, 86% of the supermarkets are run by 4 major chains. In Nairobi, it's 90% by 5 chains. In Singapore, it's 70% by 3 chains or so. So that's the real impact that we can have. We talked about food, etc., but that's really the real impact that businesses can have, definitely on health, and because they occur in cities. But I'd like to give 2 examples I really like. One is from a pharmaceutical industry, and the other one is from the car industry. Two of my favorite industries to work in. And I'll piggyback on what you said earlier. You said that more than half of the world's population lives in cities right now. But did you know that 3 out of 4 people with diabetes live in cities? So that is how important it is, right? And so ever since 2014, Novo Nordisk has this one initiative that actually goes a little bit under the radar. And the initiative is called Cities Changing Diabetes. It's one thing I often talk about in my keynotes, but it's actually 40 cities that change how they take action to battle obesity and even diabetes in their specific cities. Because again, the urban environment, it impacts how we live, it impacts how we travel, how we play, how we work, how we eat. And it's all because of those things that, if you can influence those things, at least you can impact the type 2 diabetes for sure. And so you can find online a ton of examples of cities that take initiatives. These initiatives also shared in bi-monthly deep dive talks so that other cities can be inspired about it. Like, for example, one of the initiatives that I wrote about was the Amsterdam's Healthy Weight Program, where it is apparently prohibited to advertise unhealthy foods to children. So those are some of the things that some cities might take as an initiative, and then it is shared. And all of this is pushed forward by Novo Nordisk. So I really like that idea to have that impact in cities. But another one that I also liked has to do with car manufacturers. Because if we talk in car manufacturing, most of these companies are looking no longer to cars, but they're looking to mobility. And mobility has a major impact on the way that you walk, the way that you move in a city, etc. And so they are doing a lot of experiments on how to optimize mobility in cities that actually can create a better health and well-being for people. One such example, lesser known maybe, is from Ford, who are looking into redoing I think it is an area in Michigan, in the center of Michigan, where they call it the Mobility Innovation District. And so they really are rethinking the entire Corktown in Detroit it is, and how they could build a new city that is more interesting for the health and well-being, but adapting the way that people move, how transport is organized, and so forth. And a second example in that regard is the maybe more known is the Woven City by Toyota. I don't know if you heard about it, but Toyota is actually building an entirely new city with one vision: well-being for all. And so there as well, they want to enhance the health and well-being of its residents, and they do it through different ways. So they're partnering up with a company called Nissin Foods, a Japanese company, I think it is, to actually provide complete nutritional meals to everyone, personalized, etc., in that city. All homes that they are building use sensor-based AI that constantly checks upon your health, that takes care of your basic needs, that could even enhance your daily life, which is definitely interesting for elderly people if they want to live longer, more independently. So it's really a city that tries to build a new construct, a new framework, a new city in itself, where a lot of data is gathered and where AI is very present. And to close the segment, and I think the AI part and the data part is something that we will see more and more. I saw a study passing by ESI Thought Lab, which says that right now, 67% of the cities are already focusing on AI and gathering data to optimize the structure of their city and eventually also the health and well-being of the city, so that they can, they have incident management, they have insights on events, they can do root cause analysis, they can do predictive analysis, those kind of things. And eventually what we will see is that they will build digital twins of the cities. So with all the data that they're gathering, they will build digital twins so that they can, instead of trying things out in the real world, what they will do is they will try things out with their digital twin of the city, again, with the purpose to optimize the living of the residents and in the end, the health and well-being of the residents. So I think there's a lot of things happening, and definitely the initiatives by the car manufacturers I like, but also the way that we will be using data and AI to optimize our health and well-being in the cities. Yeah. So to me, this is definitely going to be everything.
But I found your point very interesting about 3 or out of 4 people with diabetes living in cities, because I think for me, the cities are responsible of some diseases. Now we're trying to, maybe they're going to be the place where things are going to be improved. But like, for instance, in Barcelona, the level of pollution, whenever I look at my phone, it's unhealthy, like every day.
Oh.
And social determinants of health plays a big role also in that. But on the other hand, they're also doing a lot in terms of greening. We have like many streets what dedicated to people with like trying to put trees, etc. So that's actually very nice. Yeah. Agathe, what do you think?
So for me, I'm with Christophe. I think it's absolutely everything. And thank you for bringing our attention to this article from McKinsey. I thought it was really, really good to put the spotlight of cities as a place for health. When we've been designing cities over the last 50 years, there was this notion of trying to make them convenient and improving the time to go from A to B and improving the economic opportunities for people living in the city. That's always often how we think about it. But we don't always think about how to make a healthy living environment for humans. Now we're in the situation where many cities are not walkable. So you tell people they should clock 10,000 steps per day, but realistically speaking, these cities are not walkable, especially a lot of American cities are not. It's a little bit different in Europe due to the history of cities. And that goes to the point on micromobility that Christophe mentioned. When we talk about micromobility, and especially I'm thinking of these electric scooters that you find in many big cities now, I'm like everyone. I love them because when you're late somewhere, it brings you faster from A to B. But if they were not there, I would have walked. And it's really the question that sometimes the convenience that we bring with mobility solution goes at odds with our long-term health outcomes. The less we walk, it's not healthy for us. Human bodies have been designed to be active. So there's this question of rethinking mobility, not only for convenience, but also for health and getting people to move in cities. The second element about mobility, especially if you think about cars, is about pollution. You mentioned it in Barcelona. I was reading recently a report that I think only 7 countries or areas are on target with the World Health Organization levels for pollution. Only 7 out of the whole world. So that's actually really bad. I read an interesting report a couple of days ago that was saying that during the first days of COVID during lockdown, there was a huge drop in childhood mortality linked to asthma attacks. When there's no pollution on the street, there are less asthma attacks. And what I loved in the McKinsey report, it was talking about chronic conditions, lifestyle-driven conditions. The long-term impact of the pollution we're exposed to in our cities on chronic respiratory condition is going to be gigantic. They are on the rise, and it's about the health of children, teenagers, people that can carry these conditions for the next 50 years, which will have an impact on the health span that Keith was talking about. So pollution is another one, but when we talk about pollution, it's not only the quality of air, there are other elements like noise pollution. When you live in city, I'm in a fairly noisy neighborhood in Barcelona, and I used to be in a very noisy neighborhood in London. It impacts your quality of your sleep. Noise pollution has been linked to cardiovascular disease like hypertension. It drives some stress, some anxiety. So when we think about interventions in cities, how we design cities, we need to think about all these elements. Air quality, noise environment, getting people to walk. I've talked earlier about the food system. That's another very, very, very important example. It can be about mental health. There have been some studies showing that we need to be exposed to natural lights. And we're lucky in Barcelona when it comes to natural light. But in some of the cities, sometimes you're surrounded by skyscrapers and you spend your days in the shadow and you don't see the horizon and you don't see the sun, which is also not extremely good for the mental health. Which brings to the question of green parks. You know, we say that usually you want parks because it's nice, it gets people to relax, but it's actually been shown to have an impact on the mental health of people. And there are also places for socializing to avoid the loneliness pandemic. So with all these points, I really think cities are everything. But when we think in urban planning, we need to have really this question front and center in our mind. How do we design living environments that are good, that are healthy for human beings? And I'm not quite sure that's been really the priority in urban development over the last 70 years. So I love this report from McKinsey, and I think it's absolutely everything.
Excellent points. Yeah.
Well, thank you. I think it's clearly something, if not everything, and it's definitely everything for the future, that's for sure. But now, time for something else. In this Healthusiasm world, we see the boundaries of industries blurring between the worlds of healthcare, wellness, and consumer business. This brings the following question: what behavior, innovation, or trends from one industry can be worthwhile for a other industry? In other words, what should we bring inside out or outside in? So I would have to say, tell me, Christophe Jauquet, what's the idea or innovation or evolution that you would consider bringing inside out or outside in? Because I am the one that will be bringing an article or maybe some recent events actually to you. And I want to have your opinion about it, how we can use it or how it will happen in healthcare. Now, to introduce this topic, I'd like to say one thing, is that normally I write every year a newsletter, if you will, a blog post on the health and self-care trends of the upcoming year, or at least the topics that, according to me, or to my humble opinion at least, will become much discussed in the following year. And so last year in 2023, one of these topics for 2024 then was robotics. I expected robotics to be very much in the news. And indeed, if we've been 3 months into the year now, 2024 has not disappointed. Because news about robots have been all over the news. Let me quote some, or maybe you might remind some of the ones that I will mention you here. Because you might have seen small clips, maybe on social media, of the Boston Dynamics robots that are doing parkours or that are doing backflips. Maybe you've seen the RoboDog called Spot surveying the city of Singapore. Maybe you saw the Tesla robot Optimus folding a t-shirt or testing how bulletproof the Tesla Cybertruck is if you shoot with rifles on it. Funny in a way, scary perhaps as well, but sometimes very impressive. I think it was 1 or 2 weeks ago that I saw a video by Figure01, which is a robot that now has ChatGPT integrated in it. And so you could have a similar conversation with the robots as you would have with ChatGPT in your browser. And so there's this small clip online. You can easily find it, Figure01. If you just look it up on YouTube, you'll definitely see it very quickly. And in that clip, somebody told the robot that he was hungry. And then the robot looked around, picked up an apple, and handed it over to him. It later also cleaned the dishes and removed the garbage. And so by putting ChatGPT in those kind of robots, what we have is we have a combination of the mental capacities of large language models, mental intellectual capacities maybe of large language models, with the physical ability or the physical capacities of robots. And Figure1 is the only robot where large language models are integrated. Actually, earlier this week, during the NVIDIA GTC 2024 keynote, which, by the way, looked like a rock concert because there were 15,000 people in attendance to listen to the CEO, Jensen Huang. But during that keynote, the CEO launched a new general purpose foundation model for humanoid robots, which is called GROT, or I think it is. And GROT stands for Generalist Robots 00 Technology. And this is, again, big news because it's a model that is designed to bring robotics and embodied AI, so ChatGPTs and robots, together. So it'll enable the robots to understand natural language models and emulate movements by observing human actions. So a robot that looks like a human and moves like a human and actually talks like a human. Clips are coming, but it picks up really quickly. Mercedes-Benz announced that they will use Apollo humanoids and other robots in their manufacturing. And this robot specifically was only announced 6 months ago. So it goes that quickly. 6 months ago announced, now already deployed in a Mercedes-Benz manufacturing. And it is widely used. If you look at Amazon, they have deployed 750,000 robots in their warehouses. Meanwhile, technology to train robots go increasingly fast. Just last month, Google DeepMind announced their new AI model called Genie, which can create video games from sketches or photos or videos. Maybe you've heard it. But the remarkable thing about that AI model is that it can actually be trained by videos, which means that we can train robots, not just by doing it remotely ourselves, because that is how robots are trained. So there's always somebody behind the scenes that is doing the movement with the remote control, and that way the robot can remember it. But now a robot could actually then learn from videos. Or if we look at Sora by OpenAI, which is basically a video generator, a video creator, if you will, an AI tool. But they call it a virtual world simulator. So Sora will be able to create a virtual world, which will allow robots to also better understand and get data from the real world, which allows them to, navigate better the world and be quicker up to speed in navigating the world and doing the things that they will need to do. Amazing stuff, which sometimes is so science fiction-ish, if you will, that it's hard to realize what it could mean in our world today or tomorrow, let alone in healthcare. So this is the Inside Out, Outside In segment. And if we were to bring those robots of similar kind of robots outside into health and self-care, where, when, why, and how will you see the use of these robots happening in health and self-care? That is my question for the panel. And I'll go to Aline first.
Thank you, Christophe. I think it's a very interesting topic. And maybe one comment before I dive into the healthcare space. So a few weeks ago, we had the Mobile World Congress and for ISFOMNA here in Barcelona, so the big annual conference. And the most popular activities were robots. So in the health hall, There was like a Da Vinci-like robot that was built here in Catalonia. That was like busy all the time. People were coming to see that. And then in the other halls, there was one robot you could actually talk to, and he was really answering what you were mentioning before. So, and then the dogs like robots. So yeah, I think it's very aligned with what's happening. So now if I go to healthcare, how do I see the application of robots in healthcare? So mainly 3 points. The first one, and we've talked about it in different sessions already, different podcasts, more like the nano robots, the small robots that can have an application in healthcare. So we can think of some that so tiny you can't even see them, but you can like send them inside the body. They can detect like early tumors, kill them. They can deliver medicine deep inside the body. They could even clean the plaque. So for people who have like cholesterol like me. And then second application would be the Da Vinci robot that I mentioned. I think that can really make a difference for like more remote parts of the world, maybe Africa, where they don't have surgeon or they don't have enough healthcare professionals, and they could have access to surgeries through those robots, where the surgeon can actually operate at a distance. And what I was even thinking is that those surgeons wouldn't need to travel so much, and that can have a positive impact on the cities and on the planet, no? Referring to the topic before. And then where I see more application, my favorite application would be the idea of a robot as a companion. So that can be either in the home or in the hospital. So there's, for instance, the company PAL Robotics. They're developing robots that are companions to elderlies, and they are called like Spring, socially pertinent robots in gerontological healthcare. So they're robots, as you were mentioning before, Christophe, they can understand the needs of the elderlies and respond to them, bring what they need to them. And I know already for some years that there's such robots who exist at home, that if people are lonely, they can be a companion for them, and they can look like a real person, size of a real person. And they all already have the capacity to listen to the voice, to read the face. And if someone is depressed, for instance, they can just make jokes to cheer them up. And so it can be that shape, but it can be also animals. Like you mentioned the dogs, it can be this, or like a cat, like Sony made a small dog a few years ago. And then the other application will be inside the hospitals, where robots can actually be collaborating with hospital staff to enhance the patient experience. And I think that's really cool. So we see already in Asia that some robots are used to lift people, either in the hospital or nursing homes. So that's really helping so that staff are not hurting their back, for instance. And it can also be used to reduce contact and reducing the spread of infection. So that was also very spread during COVID, where robots can actually be used to disinfect rooms. They can bring food or medicine to the patient. And there's a pilot at the moment in France, in the hospital, of a robot who is at the entrance. He's welcoming the patients. He's giving them directions inside the hospitals and can answer some questions. And this is all made possible with LLM and Gen AI, no? But what they were saying, the first results of that pilot is actually very positive, and the robot is answering very well the questions from the patient. And then for me, the last example that I saw Saudi last year is the nurse robot called Grace. That will also support healthcare professionals inside the hospital to answer patients' questions. Like in that case, she was talking about Alzheimer, different questions about Alzheimer. But I think she was really good. Like questions were great. She was speaking more like a human. I think we're evolving a lot. And what I was also very impressed is that when the founder was talking to her, if he was interrupting her, she was stopping. So it was really looking like a real conversation. I think that's important for the patients, no? And maybe the last point. So I went to a conference on an exhibition on AI here in Barcelona a few weeks ago. And there was an interesting poster about Doraemon, which is a cat robot from a manga in Japan. And what they were saying, and that really made me think, is that the Japanese people they grew up with like this cat robot. So they used to co-living with robots. So for them, it's normal to have robots around. So I think it's really a cultural aspect that the rest of the countries, maybe we need to work a bit more on.
Yeah. Interesting. And I'll piggyback on what you said about, a companion at home, definitely for elderly. I came across a number this morning. I posted it on LinkedIn. If you would replace all the family caregiving by robots and AI, that business would be 600 billion.
Yeah, that's huge.
So that's huge. I mean, this is what we could do if we replace what we do now within families simply by robots and AI. I go to you, Agathe. Tell me, how do we bring robots into healthcare, or health and self-care, even wellness, whatever? What do you think?
Well, I think it depends a little bit which types of robot we're talking about. For instance, if we're talking about surgical robots, they are already present in healthcare. I think what Aline was exploring is more what we would call the service robots or the social robots. And in that space, I tend to agree that there's a lot in innovation that we have seen, especially in robots for elderly care. And Aline, you were mentioning Japan, where there might be a slightly higher cultural fit. But I think it also goes with a demographic shift in some countries. Christophe, you just mentioned the family care that is provided to elderly people. But in some countries, the population is getting older and older and older. Japan is one of them, where 30% of the population is over 65 years old. 20% is over 18 years old, I think. So there may just not be enough younger people to take care of the older people. And in that specific case, robots can have a role to play to increase the capabilities because there's just not enough humans, let's say, to do the job. So I think in some countries, it's interesting. We are going to see a convergence between cultural factors that make robots more acceptable, but also demographic factors that will justify having maybe a robot at home way more than in other countries. Another element we have not talked about, I guess, is the question of infrastructures when it comes to 4G, 5G, maybe 6G in the future. I think South Korea is starting to look at plans to have 6Gs in 2028, 2029. By the end of the decade, we'll already be in 6G, which is going to provide the infrastructure to enable more robotics in our lives. Aline, you were talking about robots to perform surgeries, like remote surgeries. This relies heavily on extremely good infrastructure. It is already possible with 4G. It will get better with 5G. It will be awesome with 6G. So in the longer time frame, I think robots will become more and more important in our life, but this is enabled by infrastructure. Now, a question I might have to the panel is if we're thinking about social robots, so having a robot at home for loneliness, for elderly demographics, when do you think it will be mainstream in European countries to have a robot at home? Are we looking at 2030, 2035, 2040, or longer in the future?
Now, I'll come in on that, and maybe I can sort of come in with some of the my thoughts on this too. But I think robots coming in as social care devices will come after robots come in for menial manual tasks inside the home. I think that the icebreaker or the point that they come in will be helping with cleaning around the house or folding clothes or something like that. Something that's seen as like not challenging, something that we would expect as well. And then from that, I think the way that robots, humanoid robots, very important to talk about here, because of course robots come in all shapes and sizes. How people respond to them will then dictate what happens next. And it could be that robots as social companions happen not by design, but by happy accident, as in people have them in their house for folding things. And then there's a feature which allows them to have conversations. And then we find that people start to form attachments that are positive. So I suspect that'll be the case. So in that case, and I think that's quite likely to happen, depends how soon we get humanoid robots in houses for other reasons as well. But if I just sort of have my reflections on this, I'm going to try and take some sort of slightly different takeaways from this. And the first of which is, how on earth are we going to afford this? Like, I can't see any of these technologies being cheap technologies. And we can't even afford low-cost human health workers right now, let alone what these might cost. Now, in the fullness of time, I think that might be solved. But what that might mean is that once again, this is going to be the preserve of people who have the resources to pay for it as well. And the jobs and the tasks that this will take will be of people who are at the lower paid end as well. So I do worry a little bit that the introduction of this, for good reason, will reinforce disparities in care. And we have to watch very, very carefully for that. But, I think that, essentially not everyone's going to get some of the benefits of this, assuming that we get some strong benefits. I think, like, my mum had her hip replaced by a robot earlier on this year. So it's already here. I mean, it wasn't exclusively by a robot. There was a surgeon in the room as well, of course, but we're using robots quite a lot already. And that was a non-humanoid robot. We've also got some really interesting nanorobots like were being described. I saw a great one demonstrated late last year, which essentially can be inserted into the brain. It's tiny, like the size of a grain of rice, but it can navigate through the brain and actually do deep brain stimulation and sensing as well. So robots are here, but the really exciting thing about what we're seeing with robots, and I agree, Christophe, it's moving really fast now. It's the embodiment of large language models. That's the most exciting thing. And I see robots, particularly humanoid robots, as potentially a new form of user interface, because people vary in their happiness about using a chatbot or using a phone line or whatever it is. But most people are generally okay about speaking to other humans. Our entire operating system is based around that interaction as well. And so robots, particularly humanoid robots, present a really good opportunity to have a much more equitable and easy to use interface for people. So, having a large language model inside something like Figure One is very, very interesting. And then the second part is that robots and embodiment capture the majority of where the data in the world is. The bulk of our brain is dedicated to living in a physical world and movement. 85 trillion synapses of 120 trillion synapse human brain is dedicated to the cerebellum, to movement, to motor function. And so far, we trained our large language models on the language, the very thin slice of what it is to be conscious in the world. Robots allow us to start capturing the rest of that data, which I get excited about the idea of that being the missing piece that will take us to truly intelligent things. For example, understanding gravity, about throwing a ball, a large language model will give a good description. But when I learnt about gravity, it was because I was a baby and I was falling over when I was trying to walk, or someone was throwing me a ball. Robots are our route to encoding that knowledge and intelligence improving. And it's the same inside healthcare. So my excitement is everything that's been said here so far. And my favorite movie is The Iron Giant. I'm a big robot fan. If we can get the equitable access sorted, I think the exciting part is this partnership of large language models and large action models and motor models. And goodness knows how much data we have out there as well. All these videos that we've posted online about people moving and doing things. So it's a really exciting time. I think it's going to move very, very fast. And in terms of social robots, I think, they'll come in by the back door almost. Maybe it won't be designed that way, but people will have them for cleaning around the house. And then, this is very convenient. Let's let it babysit the children.
Yeah, and I think we talked a bit about that in episode 17 on virtual companions. They weren't humanoid robots. We were talking about chatbots or even holograms as a partner, where they are a partner of us and where we actually have social interactions with. And so indeed, I think as long as the chatbots are convenient enough and the robots are not human enough, I think this will take a time before we get to that point. But piggybacking on Japan and piggybacking on the fact that it goes really fast, and also piggybacking on the fact that when will they be human enough, I came across a study from Japan who did something really crazy. They created a two-legged biohybrid robot. And so what is biohybrid? What does it mean? Is they combined muscle tissues with artificial materials. So the legs of the robots are actually powered by muscle tissue. So we are getting there in a sense that it goes fast. It might become human one day. pretty soon. Any last remarks before we close this session?
I was going to maybe a remark on this as well. Prosthetics. I think that the advances in robotics is going to lead to a significant advance in the quality of prosthetics for people who are missing limbs and mobility and so on. And that's a big additional topic in a world where people lack mobility and so on because of paralysis and everything else. I think there's something quite interesting about robots as exoskeletons and robots as prosthetic devices and so on. So maybe we can revisit that another time if a breakthrough is announced.
Yeah, definitely. And so with these smart words, I'd like to wrap up the Healthusiasm podcast for this month. Thank you for listening. If you liked the show, don't forget to hit the subscribe button on your favorite podcast platform. For now, I'd like to thank our own thought leaders for their insights and Healthusiasm. Thank you, Aline Loiset, Dr. Keith Grimes, and Agathe Acchiardo. My name is Christophe Jauquet. We are the Healthusiasm panel, and we'd love to see you again next month for some more Healthusiasm. Ciao. Thank you.